Good morning. This is Dr. Engel again, and the topic for today is, can we really afford Medicare for all? In these days of budget problems, of instability in the financial situation, can we afford to do this? Won't we just crash? Well, I'd like to rephrase it. Can we afford not to? Can we afford not to? For one thing, there's no change in the actual use of medicine. We fortunately have a country that is advanced and humane enough that people are not let to die out in the street. If they become sick or if they're in an auto accident, they're taken to the closest emergency and they're hospitalized, and everything that needs to be done is done, which is great, but it is that way whether you have money or not. If you have a lot of money and don't have insurance, okay, you'll end up with it, probably with inflated prices. You'll go through legal procedures. There'll be bankruptcy costs, etc., etc. It's not a simple deal. People want money to be paid, and it works better when they are paid early. The best time to get a hold of a medical problem is early. Now, I'm going on the basis of my many years as an independent family practitioner, and I was kind of obsessive compulsive, and I tried to get everything early, avoid problems, follow closely. And you know what? The expenses on my patients, even though I didn't see them as much as others, I did spend a lot of time with them. And you know, the hospital costs were very small. I didn't order a lot of medications because I took the time to actually go over and see what's needed. If you have a situation where nobody wants to spend any time because they're not making much money on it, the easiest thing is to just prescribe one other medication and then another other medication, and then test because the medication produces symptoms. So having available quality, person-to-person contact with your patient is the most important thing in medicine. It doesn't help if you prescribe medicines because the patient has no faith in them and doesn't take them. It doesn't help if the doctor just sends them to the emergency department because they don't have insurance to come in and see them. It helps financially, believe it or not, to do the right thing. And the way to do the right thing is underpinned by the situation that the patient is not stressed about coming into your office, will follow through as needed, and does not have to deal with a lot of insurance companies that specialize, and I mean specialize in this. It's a terrible sense of irritation by most practicing physicians that we spend half our time telling the insurance company why they should pay for something, why they should okay this particular medication, why they should allow this test, and ending up with everybody paying more because they end up in the hospital not treated or with complications of medication. So having a situation where everybody has it, they don't have to think about it, they don't have to stake out a medical system to see how good it is. It's there. And it gets everybody in, whether they're a small office or they're a university. It covers everything. Lots of other things it does. Well, when Medicare fills out the forms, it costs them some amount on their side. And it's pretty small. It's below 5%, and consistently that way. The insurance companies don't do that well. They run about between 15 and 20% of the money that goes for patient care actually goes for administration. And again, they specialize in this not offering certain care, and they have to spend time with their specialists talking to the doctors back and forth. If the doctor really wants to fight for something, yeah, we'll get it. But it gets a little tiring when you have successive experts coming up tell you why. Well, can you use this? Or did you try this medication? Or did you try this medication? Did you get that test? Did you get a consultant? On and on and on. All this stuff costs money. And it causes a real injury to the doctor-patient relationship. He can't just walk in, get seen, recognized as a patient, and then getting taken care of. So that whole system gets affected. There are a lot of indirect things. Our balance of payment. Our companies pay medical care for the employees. If you have a system where the government provides all the medical care, this does not enter into the balance of payment. So actually, by doing this, we are promoting all the overseas competitors, and nobody sees it at all. Another big thing is just the uncertainty. We are spending, all of us, too much of our lives in uncertainty. The difference in income between the underclass and the top 0.1% is getting more and more. And everything that's done to help that is criticizing as something that will take away motivation to work, motivation to make a man of yourself, and you're just basically lazy if you don't get the money. Well, there's no perverse motivation in here. What you want, a person who wants to work, wants to succeed, gets treatment, gets his back taken care of that he can work, gets injuries handled, gets depression handled. Medicine should be something that helps people, that lifts them up, that encourages them, and allows them also to have a really good relationship with their doctor. If you don't have that, believe me, nothing works. The doctor and the patient have to become like one person. It has to go back like to be a cranky old doctor. When I started practice, there were only two people in the room, the doctor and the patient. Now we're the only ones who have nothing to say. Well, giving care for all, where they don't have to battle on it, and where the doctor can spend his time with the patient and not on battling with the insurance, is essential. It's the first step, second step, and third step. See you next time.